Welcome, everyone, to today's webinar, Transforming Your Supply Chain for the Future, Setting the Stage for Success. This webinar is made possible through the generous support of Cardinal Health. I'm H&HN Senior Editor Susanna Hopsalerin. Each year, the healthcare supply chain wastes $5 billion with declining reimbursement, an aging population, and shift to value-based payment models intensifying cost pressures. Traditional approaches to supply chain management are no longer working. During today's webinar, Cindy Measurall and Ken Shastany will discuss how automation of your supply chain can lead to cost-effective ways of managing your inventory and transparency across your supply chain while rebuilding trust between the supply chain and clinical teams. They will explain how advanced analytics can help control costs, capture charge accurately, and support clinical documentation, all while reducing waste and simplifying workflows. Our webinar will begin with a presentation by Cindy Measurall and Ken Shastany, and will conclude with a 15-minute question and answer session. All lines have been placed on a listen-only mode. To submit a question to be addressed during the question and answer period, please click on the Q&A button at the bottom of the console. Simply type your question in the box and hit submit. Questions can be submitted at any time during the presentation. Let me briefly introduce today's speakers. Cindy Measurall is the Director of Supply Chain Strategy at Cardinal Health, and Ken Shastany is the Clinical Consultant with the Strategic Solutions Team at Cardinal Health. It's now my pleasure to turn the floor over to Cindy, who will begin our presentation.
Thank you very much for that introduction, and welcome everybody. As you just mentioned, my name is Cindy Measurall, and I am the Director of Supply Chain Strategy at Cardinal Health. I've been with the company since 2004, and I am a Lean Six Sigma Black Belt. In my role, I'm focused on bridging the gap between folks in supply chain and the clinical staff that they support. So I've worked in numerous areas connected to the supply chain, including operations, transportation, and even customer service. With me today is Ken Shastany. Ken joined Cardinal Health in 2013 and is currently with the Strategic Solutions Team. His team is dedicated to improving patient care, safety, and clinician workflows while reducing waste and cost through inventory management solutions. Ken has over 30 years of experience as a nurse, with the majority of that time serving in multiple cardiovascular-focused roles for organizations including Brigham and Women's Hospital, Tufts Medical Center, and Hallmark Health. His responsibilities with these organizations ranged from procedural nurse in the cardiac cath lab, EP and IR, operations and nurse manager of these areas, and as a director of cardiovascular services. The heart of why we're here today is to discuss how to manage your supply inventory more effectively. Over the next hour, we'll explain how supply chain challenges are universal. So that's right, you're not alone. And how those challenges can be addressed during rapidly changing healthcare models affecting the economics of your specific hospital system. To help us get there, we'll start with a brief overview of Cardinal Health, and then we'll move on to the healthcare trends that are impacting the hospital supply chain today, automated inventory management processes that can help, and finally the steps that we can take to support an investment in automation in your hospital. The challenges in healthcare supply chain are complex, but the answer doesn't have to be. You just have to know where to look. So let's get started. As I mentioned, we'll start with a little bit about Cardinal Health. As one of the largest healthcare supply chains in North America, we are essential to care. We help our health system customers focus on patient care while reducing cost, enhancing efficiency, and improving quality. We have a deep expertise in supply chain and have a strong culture of Lean Six Sigma. We have been recognized by Gartner as the #1 in supply chain innovation for 4 consecutive years from 2011 to 2014. As you know, the supply chain doesn't stop at the hospital dock. Instead, it leads us all the way to the point of use within the hospital, ending at the patient. With that at the forefront of our minds, we continue to challenge ourselves to innovate and create value, something that all of us in the industry must be doing today with the dynamic healthcare environment around us. So let's talk about what's happening in our industry. Everybody knows that the landscape is changing. There is risk with the new bundled payments. There's concern about reimbursements and the constant push to reduce the cost of care. A lot of this is now falling on the shoulders of people in supply chain. Supply chain leaders are finding themselves responsible for off-site clinics, medical offices, and for more than just supplies. Customers that I've been working with have communicated that they're now responsible for record retention, equipment storage, laundry, mail, copy centers, couriers, and some are even responsible for dietary. And then there's the ongoing pricing pressure that has existed forever, the push to reduce the cost of each widget. The transition from the fee-for-service reimbursement system to one that's based on value is one of the greatest financial challenges health systems are facing. Health providers are not only shifting to shared value, they're also shifting to shared risk. Those providers and health systems that can't achieve the required scores will face financial penalties and lower reimbursements. This is why health systems are focused on broad-ranging clinical, financial, and operational improvements. Our customers are the leading health systems. We believe that these highly integrated delivery networks are the future of healthcare. In order to help them achieve clinical, financial, and operational excellence, we must be fully aligned with their needs. We are uniquely positioned to help them improve their financial performance, stay ahead of healthcare reform, and advance safety and quality of patient care. Let's talk for a moment about how this is impacting providers. You may be asking, what does the shift to value-based care mean to the healthcare providers? It means that there is an urgent need for healthcare providers to control costs more than ever before, as declining reimbursements threaten hospital revenues and profits. Specifically, there's new and increasing pressure to reduce spending while improving outcomes at the same time. There's also the new reality of financial risk and cost shifting from payers to providers, as I mentioned earlier with bundling. And providers are under more pressure to demonstrate differentiated outcomes and improve care coordination, not to mention patient care itself. At stake are hospital and physician bonuses, which are increasingly based on measuring performance and improving cost, quality, and patient outcomes. In short, healthcare needs a new source of savings. So where should we look? As you heard in the intro, the annual waste for higher value medical devices alone is over $5 billion. Much of this waste is due to poor inventory management practices, and that doesn't include the hidden value that gets lost due to misaligned labor, product recalls, and noncompliance. You may be asking, who's paying for all that waste? We all do. The manufacturers, providers, the payers, and ultimately our patients. So this is contributing to a higher payment side of the value equation. $5 billion of waste. Think about the impact that our industry could have if we pulled together to fix this. So what can you as a healthcare provider do to reduce the waste within your organization? That's why we're here today. While the problem is everyone's, so is the solution. Together, we can solve this, and the time to act is right now. Everyone will benefit when we start to chip away at that $5 billion of waste. By healing the supply chain, we'll improve efficiency, we'll lower cost, we'll improve clinician and patient satisfaction, and most of all, the quality of care. Ken is now going to share with you the 4 steps to take to reduce waste in your facility.
Thanks, Cindy. So what can you as a healthcare provider do to reduce the waste within your organization? I'm sure you're thinking that there are several things that need to happen in order to achieve this, and you're right, obviously there are. We've organized them into 4 points, and we'll talk about how to achieve this today, and we'll dig a little deeper in the next few slides. The first step is connecting the supply chain. The second is aligning supply chain priorities. The third is to look for process improvements. And finally, the 4th step is to make informed decisions through the use of analytics. The key to this solution is working together to meet these challenges. As a result, the supply chain costs will be lowered and more efficiency will occur from the point of receiving to the point of care. Today, our supply chain can be viewed as a collection of disjointed silos, and our vision is to form a seamless continuum that operates efficiently from end to end. Transparency is the key, being able to share product and utilization information at every touch point. Then, having the analytics to transform this data into actionable information that leads to more effective decision making. And finally, on top of this, we need to overlay a logistics platform that moves products according to what we learn from database metrics and goals. So how do you achieve this? This can be achieved through supply chain automation. It is key to not only reducing waste, but also to meet the 4 goals that we outlined on the previous slide. So, around creating end-to-end product visibility, we can align clinical and supply chain initiatives. Let's break down the barriers and the trust issues between materials departments and clinicians. We can improve processes using automation. We need to remove non-value-added activities by all members of the healthcare team, particularly the caregivers. Having the ability to make informed decisions through the use of analytics is critical. Often in my career, I can recall making many decisions on managing inventory as being based on intuition or the expensive mindset that if stocking 2 stents is good, then stocking 4 is great. This is a good way to assure product availability, but not a very good way to run a business. So how do we overcome these challenges? How do we improve efficiencies and reduce costs? Whose responsibility is it? To start and to try to answer this question, let's start with our first goal, how to create a connected supply chain. The root cause of all the waste and rising costs is how complex today's healthcare supply chain has become. Just think about the sheer number of items in your item master file, then add the direct order and physician preference items that may or may not be recorded there. The lack of end-to-end visibility from point of manufacturer to point of care is also a major contributor to this complexity. In order to have visibility, you have to start first by knowing what you have. Think about it. The most common approach to managing product is still manual counting, which is inefficient and prone to human error. People are just really bad at counting stuff. The lack of integration. As I mentioned earlier, there are multiple systems that operate in silos and don't talk to one another effectively, which further complicates product stocking and inventory management. This also obviously leads to frustration and duplication of effort. Lack of visibility results not only in waste, but also difficulties in knowing how much inventory is on hand and finding those expired and recalled items. In my role as a clinical consultant, I often hear nurses stating that they cannot find what they need because there's simply just too much stuff. They then call down some materials to send additional supplies up that were actually already on the nursing unit that they just couldn't find because of clutter. This adds delays and increases everyone's frustration. Obviously, it increases cost as well. According to the FDA, there were nearly 1,200 product recalls in 2012, and 99% of all product recalls are handled manually. We need a system that is going to help automate the recall process and streamline that, because this is a really important safety initiative, clearly. As the healthcare industry shifts to value-based payments, it is critical to find a solution and workflow to meet these challenges and thereby lower supply chain costs. Cindy, could you explain to us how this is being managed in other industries than healthcare?
Absolutely. Thanks, Ken. I'd like to walk you through an example of buying a disposable razor at the supermarket. At the checkout counter, you actually start a chain of data that links that razor that you just purchased back to the distributor and all the way back to the manufacturer. Then that data might go to a company that monitors consumer purchasing behavior, such as Nielsen. The result is total upstream visibility of your razor from the manufacturer's facility to the point of sale and into your hand. The manufacturer now has an advanced set of data to analyze and truly understand consumer needs, which makes demand planning more accurate. The manufacturer can set production quotas based on real-world data and make just the right amount of razors to meet the consumer demand. Not too much, not too little. So there's far less waste and efficiency in that process, and far less need to overstock and hoard products. The data tells the razor manufacturer and the retailer exactly how to right-size their inventory levels. In a nutshell, the data makes it possible to have a more efficient supply chain. Shockingly, the retail industry can do this for a disposable razor, but the healthcare industry cannot do this for supplies that cost thousands of dollars more. So imagine if we had the same level of visibility for a hip prosthesis that we have for that razor. A hip prosthesis can cost up to $18,000, a far cry from the razor that's going to cost you less than your favorite latte. And unlike the razor manufacturer, there's no data capture and connectivity from the point of care back to the manufacturer. There is no upstream visibility, and no real-world data analytics that can help us understand demand planning. It's not that we're completely flying blind, and it's not that the hips are the only product that have this problem. It's affecting all of the products in supply chain. But the healthcare supply chain has good data today on purchases from the manufacturer to the distributor and from the distributor to the provider's door. So we know what was shipped, we know what was bought, and eventually used to care for a patient. But that's where the story stops cold. We don't have any data about the next critical moment, the actual use of the product at the point of care. Going back to the razor example, we know that a razor was bought, but we don't know anything about what happened at the checkout counter. So why does the healthcare industry have such a difficult time managing inventory when other industries find it easy? Today's hospitals typically see a gap in the alignment between clinical and supply chain initiatives. For example, a supply chain manager may be focused more on product visibility and eliminating waste, while clinicians are focused on patient care and documenting implants. Stakeholder priorities vary, and there is a misunderstanding on the responsibilities and ownership of individual roles. However, if we dig deeper, you'll find that there's more alignment than you realize. Ken, can you walk us through the disconnects that you experienced as a clinician with this process?
Sure, thanks, Cindy. Be happy to. So, for example, the supply chain managers, directors, business manager, and clinicians all have their own sets of priorities, as you can see here on this graph. However, goals are actually a lot more aligned than you might think. I think one really good example is that the supply chain directors are concerned about visibility. That doesn't mean the clinicians aren't. A good example is that the clinicians also need to care about product visibility because they have to have the right item available when it's needed. So think about your timeout requirements for your joint commission in the OR or the specialty areas. Part of that timeout requirements mandate that you have to have the right product along with having the right patient, the right side, et cetera. So that is a critical area where there is alignment in their viewpoints. While it looks like everyone is generally on the same page, there's still confusion about who's responsible for what, and there may be a lack of confidence as well. For example, clinicians may be concerned about whether the supply chain manager will perform the right actions, that is, ordering the right product, assuring that it's there, and vice versa. The supply chain manager might be concerned that the nurses are being wasteful of the product or that they're not documenting that it was used. So how can we address these challenges? For instance, we would all agree that we want clinicians to focus on what matters most, and that's obviously caring for patients. There has to be a better way, and we can start by clearly defining roles and responsibilities. Improving communication among cross-functioning teams will help gain stakeholder buy-in to make needed changes. And most importantly, making those changes as comfortable as possible so that clinicians don't feel compelled to create their own workarounds. Automating your inventory management can be a critical part of the solution by establishing clear roles and responsibilities for every stakeholder. Now that we've discussed on creating end-to-end visibility and aligning supply chain initiatives, let's take a look at how automation can help with process improvements. So here we are, we're at step 3 now. Look for process improvements. Some of the challenges faced today include clinicians managing supply chain tasks, particularly in specialty areas, I know that I was responsible for managing all the specialty items in my cath labs and IR labs when I was a nurse manager. And this takes away from focusing on patient care and clinical functions. Manual processes add numerous steps to workflow, even in those systems that are supposed to alleviate them or eliminate them. So let's take a look at what clinicians encounter today in the supply chain process. There's a lot of clinical time wasted on supply chain and other non-essential duties. So we need to free up nursing time for these nursing duties. Research studies have shown that nurses can spend anywhere from 6.3% to 20% of their time on non-value-added, wasted activities like hunting and gathering of supplies. This could be the result of time spent on the nursing unit looking for stock that is or isn't there, calling the materials department to deliver stat supplies, or running off to another unit to get the needed product. Or in the case of the OR, the nurse that has to pick the case cart because the SPD didn't complete the job, or that the products were not available in that area and the nurse had to pick from the central core. As I mentioned a moment ago, in some cases, attempts to better manage and control inventory actually make the problem worse. The best example of this is when supplies are treated in the same manner as medications. We're all familiar with the automated cabinet systems where essentially you're dispensing product or dispensing medications. And we know about the reasons and the rationales why you have to control medications and the legal ramifications. But this approach to inventory does not work quite as well. And here's why. The point of dispense cabinets create multiple extra steps. I'm just going to walk through a few of those just to kind of give you an idea. So think about the workflow. In order to gather a supply, and I kind of have a procedural-centric view of the world because that's where I spent most of my time. I'm the nurse in the procedure room. The doctor wants some supplies. I have to go to the electronic locked cabinet. I have to sign in, find the product I want in the list by scrolling through multiple screens, select the products, find the patient in the system, and charge the item to that patient, and debit the product from inventory by pressing a button inside the popped cabinet door. This function can take anywhere up to a minute per transaction, and I might have multiple transactions. So if I'm going to be going to the cabinet to grab a $1,600 stent, I shouldn't have to go through the same workflow steps if I'm going to just be getting some gauze or some IV tubing. After all that's said and done, if the product was not used, the nurse will have to kind of reverse all those steps to credit that back into inventory and to the patient. Talk about burdensome workflows. It's critical to improve this and to get nurses back to the bedside for obvious reasons, but to primarily improve patient care satisfaction and outcomes. The National Nursing Initiative, called TCAB, or Transitioning Care at the Patient Bedside, gives a lot of great examples of this. The goal is to increase nursing time spent on direct patient care and improving quality outcomes and patient satisfaction. Patient satisfaction is going to be, and already is, and is going to be a much more significant factor in hospital-based, value-based purchasing, making up to 25 to 30% of your performance score through 2016. CMS was going to be upping the ante on this and increasing that by 2% for reimbursement dollars ultimately being at risk by 2017. With a growing amount of revenue at stake, hospitals must be looking for strategies to improve their patient experience and improve their patient satisfaction scores. So how do we free up nursing time? So the way we free up nursing time is to streamline and automate. We first need to simplify inventory management. Let's focus on one area that's ripe for improvement. What happens when a product is logged in and reordered using the current manual process? And I'm going to go back to the example I used a moment ago when, as an old cath lab nurse, the doctor had asked me if I would go and get some supplies. So products needed during the case, he's not exactly sure what he wants. So I'm going to go and get 3 different size stents. I'm going to get the one that I think he needs and the ones that he asks for specifically. I have to go through the process that I described earlier, which is actually about 8 steps. And by the time I get back to the procedure room, the doctor's standing there clicking his heels, looking at me like I went off for a coffee break. So finally, I have to open the product, and before I do that, I have to check for the expiration date to make sure that that product is still fresh. I provide the package to the physician, and then I have to document in the clinical documentation system, I have to document in the inventory management solution, and I have to peel stickers off of packages which will probably get lost. So all of this is trying to just keep track of that one item. So now I have a couple of other devices that I brought into the room that I didn't use, and those are now out of inventory, and I have to restock those. So now I'm going to have to reverse that system, like I said earlier, and go and put those away into that system. So this is an automated system that is trying to help but actually hurts. So now let's compare that workflow to a fully automated solution where we can decrease those 12 manual steps down to just a handful. So when the product arrives at the hospital that is going to be stored in inventory, it can either be registered into an inventory management system by the manufacturer, who may or may not use the same platform to monitor their inventory, or it can be registered on-site by materials department so that we're front-loading the work so that the clinicians are not having to do it. When that item is placed into inventory, it should be placed into an automated cabinet, or it should be read automatically as being listed in inventory, where we will see that it is what its lot number, serial number, and expiration is automatically without anyone having to do any counting. We will also know when that item goes and leaves the inventory. When the item is taken to be used, it should be unencumbersome for the nurse. They should be able to go in, grab the item, go, bring it to the procedure room, open it up, and simply wave the package or the barcode by a reader, telling the system that it has now been used during a case, and that should feed the downstream systems, replenishment, billing, clinical record, etc. So you can see how simple wave of a product should be able to reduce the amount of time spent. So Cindy, given your Lean Six Sigma experience, can you discuss some of the best practice in inventory management to achieve these goals?
Of course I can. And there's not a one-size-fits-all answer. There are actually several best practices for success. So let's start with using RFID technology for your high-value products, such as implants. There are many advantages to RFID. First, it helps eliminate the possibility of implanting an expired product into a patient. Next, RFID allows you to quickly locate recalled products. There's easy access for clinicians, and it's intuitive. As Ken just described, you take the product in and go. And if you don't use it, you just put it back on the shelf. Because the product's location is tracked automatically, you always know where it's at. If another department borrows it, you know it. And if it's not on the shelf, but it hasn't been charged to a patient, you can find it. And the solution is scalable. It allows you to start small as you build a case for technology and then grow as your needs change within the department or your hospital or the entire IDN. But you won't use RFID on a cotton ball, I sure hope. And that's why we recommend a tube and Kanban system for your lower-cost commodity products. In this system, the supply chain team takes care of managing inventory and rotating the stock. This system supports first-in and first-out inventory management, which helps avoid expired and obsolete products, even for the lower-cost items. Once again, clinicians can just take products and go. So for those of you that aren't familiar with the tube and Kanban system, the trigger is an empty bin. So once you've used all of the product in the bin that's sitting in the front, that creates a demand signal that the bin needs to be filled again. So there is no counting of every item and refilling up to a par that way. But you also have to have a system that has accurate charge capture, one that would replace the many manual processes that exist today with one automated step that only takes a few seconds to complete. No hard copy logs to keep, and improving compliance while you're at it. Next, it should interface with your hospital's existing systems to improve data connectivity. So having an interface that would eliminate the possibility of duplicate entry. Importantly to me as a black belt, you should never have to cycle count anything. Cycle counting is a waste. So having an automated system helps eliminate manual counting and errors, in which significantly reduces the time spent managing your inventory. But you also need strong analytics, a platform that will provide accurate, real-time data. So you can collaborate with your supply chain team to set inventory levels based on more predictable ordering patterns, not on somebody's gut feel. And this is going to take us to our final step. Hospitals are no longer in the position to be reactive with their inventory management. You have to be able to make decisions. So here are a few challenges that our hospital customers are encountering. They're having a lack of visibility to par levels and on-hand inventory, having a hard time or very difficult time recognizing consumption patterns and physician usage, being able to anticipate expired products before it expires, and locating recalled products once a recall notice has gone out. So let me walk you through how data-driven analytics can help with these challenges. The key to the effectiveness of our inventory tools is having a single software platform. It's cloud-based for web accessibility. It serves as a single repository for all of your supply data across your hospital and even your health system. And it features built-in analytics to help you do your job. This is our solution. Our solution allows you to uncover powerful insights that can help control cost, reveal savings opportunities that you may not have considered before. It helps you avoid stockouts, helps increase the efficiency and productivity of your team, and virtually eliminates concerns over expired, obsolete, and recalled items. Our analytics allow you to detect patterns and trends related to par levels, your on-hand inventory in real time, consumption patterns, anticipated expirations, again, before the product expires, managing product recalls, identifying strategic purchasing opportunities, physician usage, and even more. So let me walk through how another layer can be obtained by using analytics. This is just one example of what you can do when you deep dive in. Imagine using a cloud-based analytics platform to conduct a deep analysis of your cost per case. This level of data granularity would reveal utilization by supplier, product type, case type, procedure area, and even individual physician. So not only would you have a thorough itemization of your total cost, you would also reveal new opportunities to reduce variability and improve efficiency by identifying outliers, such as rebate agreements. This is the power of automating your inventory management. So let's have Ken explain how these tools all come together to form a total automated inventory management solution. Sorry, folks, we may have, Ken, have a technical difficulty.
I'm sorry about that. I apologize. So, thanks, Cindy. Sorry about that. I had myself on mute. I was clearing my throat earlier. So the workflow around the automation using the system would be that we have multiple manufacturers right now that are using this existing technology to ship pre-registered and pre-tagged products to hospitals. If a product arrives to the hospital and is pre-tagged, it's very simple. The hospital simply places that item on an automated RFID reading cabinet or uses a smart wand to add that into inventory. That's all they have to do. Now you know exactly what that item is, when it expires, what its lot and serial number are, and you can have all that information at the touch of a button. If those products do not arrive pre-tagged, the hospital can take the steps of registering that into the system. That only takes a few minutes to do an entire shipment of product. So, for example, we have one customer who receives 70 items in a day, and he can process all of that in 10 minutes, and now he doesn't have to do any more spot checking or counting of those items and searching for the expired product. Those items are then placed in the inventory. As I said, they can go placed right on an RFID cabinet. And when the item is needed, the clinician simply removes it from the shelf. They don't have to do any logging in and debiting or charging to a patient at that time. They simply grab and go, take that item into the procedure room or the OR, and wave that tag by an RFID reader, or in the case of a product that is not RFID tagged, scan the manufacturer's barcode. That will document inside the system that that item has been used, and also the information will flow downstream into the clinical documentation systems and into the billing systems, and when necessary, signal a replenishment into your materials systems. On top of that, we layer on the analytics where you'll be able to make some sound business decisions about what you want for par levels down the road. So basically, the process repeats once the product is reordered. All set, Cindy? Back over to you. Sorry about that.
Thank you. So where do you begin? The ideal inventory management solution must address the sheer scope and complexity of your supplies. As I said earlier, it's not a one-size-fits-all. You need to have the right inventory tool for the right product, as you see on your screen. And that may sound simple, and using it actually is simple, but the right inventory management system is built on a foundation of complex supply chain science based on lean methodologies and Six Sigma controls that eliminate process variations. The right system is proactive, not reactive, and it improves efficiency and drives down costs, all while freeing up more clinical time to dedicate to patients. You want to pair the right data collection tool with the right product. As I mentioned earlier, that's using RFID for your high-value products and a tube and Kanban system for your low-value commodities. The right system is also scalable and connects your supply chain from end to end, from the manufacturer to the point of care. Think back to the razor example. The system automatically collects actionable data about product consumption, annualization by physician, which can help optimize your inventory spend. For example, a hospital might say that they have 17 days of inventory on hand, when in actuality it could be 70 days of items that are on hand. So we've created a solution to meet the challenges that we know that you're facing, because they're our challenges too. We are all working to overcome the greatest cost pressures any of us have ever faced in our careers, to shift inventory responsibility away from the clinicians and over to supply chain so nurses can focus more on patient care. We're working to replace manual and inefficient processes with leading-edge automation to eliminate waste and efforts as a result of this. We're working to provide a wealth of data analytics that reveal what actually happens at the point of care to improve product utilization and purchasing. This is the future of automating inventory management throughout your organization. And best of all, you don't have to wait. It's here, it's now, and it's at Cardinal Health. I'd like to thank all of you for your time and attention today, and now we will be happy to answer some questions.
Thank you, Cindy and Ken, for your presentation. We will now begin the question and answer portion of today's event. As a reminder, you may submit a question by clicking on the question and answer button at the bottom of the console. Simply type your question in the box and hit submit. Our speakers will answer as many questions as possible in the time remaining. Questions that are unable to be answered in our allotted time will be shared with the speakers for follow-up offline. Our first question, Cindy, is from a small and rural hospital without a large budget to invest in fancy technology. Is this solution affordable for them?
Thank you. And actually, this isn't the first time we've heard a question like this. One of the best things about the Cardinal Health Inventory Management Solution is that it's scalable. It can be used in one specific procedural area and expanded once you've seen the success and cost savings in your facility, or you can start with a larger focus. We have some customers that want to exclusively focus on managing their med-surg supplies, the low-cost items. And we also have other customers that want to focus just on the high-value products. In some cases, we have customers that want to do both. as I've mentioned before, our solution is not one size fits all, so it's designed to meet the needs of each customer. That scalability makes it easier for supply chain leaders to gain buy-in for inventory management technology. So even in a rural hospital, you can start small by trying it in one area and then expand as you see the benefit and gain buy-in from others in your organization.
Ken, how does barcoding compare to RFID technology? What is the main difference?
Actually, we get this one a lot, thanks. So the main difference is that barcode is truly a semi-manual process, because what you have to do in order to accurately read products with barcode is you have to have line of sight, and you have to be able to scan each of the items that you're hoping to count. Or you would have to scan a barcode, then manually count those specific items in that group. So, for example, when the material staff go up to a floor, they scan the barcode on the bin, then they count those products. As mentioned earlier, people are not very good at counting. With RFID, it does not require line of sight, and there's a lot less confusion for the person using the system as to what they need to do. So, for example, if I'm going to scan barcodes to do my inventory, it may take me about 2 seconds, 3 seconds per item that I'm touching. And what I am not going to collect for information, unless I scan all of the barcodes on that product and all of the barcodes of those items, is I'm not going to collect the lot, serial, and expiration data and store that in my system. With RFID, you do not have to have line of sight. So using a smart wand, for example, you could count 50 to 100 tags per second, which equals 50 to 100 discrete products. So I am no longer having to do that manual count or scan every single item when I use RFID. So the count is a lot more accurate. The granularity of the data is incredibly high and a lot easier to collect. So you could probably do an inventory count in a room, a typical cath lab using the smart wand. You could count the inventory in about half an hour versus several hours with a smart wand, with the barcode, excuse me.
Ken, we have some additional questions on RFID technology.
Sure.
Is your RFID technology high frequency or ultra high frequency?
Yeah, that's a great question. That also comes up a lot. We have focused on high frequency, or HF tags, which operate in the 13.56 megahertz range, which was pretty much universally adopted for consumable supplies in healthcare. UHF is great for kind of getting that room level, much broader read range of products. And the reason that we did not go with that is because we wanted to make sure that we were very precise with locating the products that we're tracking in our system. So if you think about it, if you're just interested in tracking at a room level, you could know that something is in the room. What you don't know is, in using the ultra-high frequency, what you don't know is whether that's in the trash barrel or it's in the room adjacent to it, because the UHF can read through walls, or where that's located, because if it's not put back where it belongs and it's still in the room and you can't find it, it's still no good to you. With the HF, we are controlling the environment where we need to know exactly where that item is when you need it, and our read reliabilities are a lot higher, over 99%. And I've heard some customers claim that with UHF that they boasted read accuracy of 75 to 80%, which, if you think about $1 million worth of inventory, being off by $250,000 is really not exact enough for what you want to be doing here.
Ken, can you clarify if it's active or passive RFID technology that's used in the healthcare system?
Sure. So active technology, active RFID tags are reserved for pretty much like asset tracking or real-time location. So, for example, if I wanted to keep track of my infusion pumps in the hospital, I would affix an active tag. An active tag simply has a battery where it basically is like a transponder sending out its ID over the system and can get picked up at a much broader range. Those tags are a lot more expensive, and you're not going to use those for one-time use consumables only. Active tags will also be used for tracking people and patients and wheelchairs, things like that. I'm sorry, go ahead.
I was wondering, we have another question, where does the tagging of the RFID products take place?
Okay, yep, sure. So the tagging can take place, as I said, both at the manufacturer's distribution center, depending upon the supplier, or it can take place at the hospital. And most of our customers that are in the specialty areas, cath lab, EP, IR, OR, are tagging when the product is received to the department. And the active tagging is simply scanning the manufacturer's barcodes into the software, affixing the RFID tag and waving it by the reader, and hitting submit. So the active, what I just described, takes longer than the act itself. So I would say it takes about 5 to 10 seconds per item to process these things.
Thank you, Ken. Cindy, what changes would be needed to be made in terms of infrastructure if a healthcare organization were to adopt this technology?
Great question, and that really does depend on the needs of the individual facility. The change in infrastructure could be a reorganization of a supply room or replacing older cabinets with the RFID-enabled smart cabinets. So if you think about your specific hospital or facility, you need a solution that's flexible. So we have experts that actually come in and identify ways to make your supply rooms or your supply area work with the technology solution. So it'll fit in rooms of all shapes and sizes.
Cindy, can you explain how much does the solution cost? How is it priced out?
Sure. And that's going to vary, really, based on the solution and the size of the implementation. So if you imagine, the needs of every hospital could be different. But two of the key areas that greatly affect the price are the number of departments and the types of supplies that are being managed. As I mentioned earlier, the uniqueness of our solution is the scalability. So it can be used in one supply room, multiple supply rooms, and expanded into multiple procedure areas. So during that assessment that I just mentioned, where folks come in and look at your supplies in your rooms, our team works with the customer to understand the pain points and then prioritize the supplies and the areas where better inventory management is needed the most. And then the customers can expand and grow that solution as they build out their case and receive staff buy-in. So customers can expect a significant reduction in the beginning, in the first year, followed by sustained improvement thereafter. And that's influenced by the elimination of expired and obsolete products, as well as the smoothing effect that's achieved by having the right amount of inventory on hand, which comes from the analytics that we talked through. So we've seen full ROIs for our customers in less than a year, meaning that the solution pays for itself in the first year. So to answer the question, it really does vary based on the size and the scope of what each customer needs.
What are some steps that a healthcare system can take for their clinicians to better understand the business side of inventory management and how the use of an automated system can help them?
I'll take that one, and that's a really great question. As I mentioned before, in my role, the goal for us is to bridge the gap between supply chain folks and the clinical staff that they serve. You have to get the buy-in from your clinicians because they're the ones that are going to be interacting with the technology at the point of use. And if you put in a system that they don't like, they're not going to use it. So you have to get their buy-in. So to get their support, I would start by asking them up front about their pain points in managing inventory today. And they're likely going to tell you that they spend too much time picking products, counting products, or hunting for products. So you can then tell them all about the benefits that they would realize by automating those processes and making it easier for them. So when you talk to them, you should share with them that they could be spending more time with patients, which we've talked a lot about today, that they could have simpler workflows, spending less time and energy on inventory, and that they won't have to worry about having too much or too little product on hand. They won't have to hoard and hide things in the ceiling tiles as we've seen. And once you have a clinician on board, you can use them to convince others as well. Their voice really is one of the loudest within the hospital system.
Ken, would you like to add anything to that?
No, I think Cindy pretty much covered all of the bases on that. I do believe that gaining some wins for the clinicians is really important, and one of the things that I think we can do with our solution that's unique to any others on the market is that we help identify before and after, and well before that there's expired product sitting on the shelf or short-dated product, but directly at the point of care. So when the clinical team are using product, because of the specificity of RFID, they can see clearly with a bold warning that, hey, you're about to use an expired product. Are you sure you really want to do this? I think that that's a great win for them. They also have the ability to improve their documentation, both their process and their accuracy of their documentation using the system, because we integrate with, in the cath lab, for example, the major hemodynamic systems. We can integrate with that with a simple connection via a cable, where the documentation of that product is simply done by waving the RFID tag. So it's really critical to gain wins for the nurses and techs that are using the system, and if they are able to gain those kind of wins, then they're going to be using the system more accurately, and therefore your inventory management is going to be that much more accurate and more easy to manage.
Thank you, Ken. That concludes the time we have available for questions. In the next few days, all attendees will receive an email that will include a link to the archived webinar session. If your question was not answered during today's webinar, your question will be answered by email. We want to thank our audience for joining us. Thank you to Cindy Mejeral and Ken Chastany for sharing the benefits of automated inventory management processes that can help to drive more efficiency, reduce costs, and provide better patient care. Thank you to our sponsor, Cardinal Health. Thank you again for joining us. This concludes today's program. Have a wonderful afternoon.